Having us here today. And here we go. In October of every year since 1985, America turns pink. This color change heralds the flurry of walkathons, fundraisers, and short-term activism dedicated to overcoming the most notorious of women's diseases, breast cancer. In recent years, though, activists have questioned the value of philanthropic corporations like the Susan J. Komen Breast Cancer Foundation. Although the Pink Ribbon campaign has increased the visibility of breast cancer, they argue, corporations latch onto the disease for profit, not out of altruism. For over a century, healthcare activists have used women of all ages, races, and social strata, albeit in different ways, as tools to promote the anti-cancer campaign. The foundation of breast cancer activism, as it now appears, can be traced to the early decades of the 1900s. Groups like the Women's Field Army, founded in 1936, facilitated mass mobilization of white, middle-class women as activists, increased education, and encouraged more women to seek care, but they did so within the parameters set by a restrictive patriarchal medical system. In the immediate post-World War II years, the limitations of working within this system became apparent. As the anti-cancer campaign became more corporate, white women lost even their limited role as educators, serving instead as symbols for the campaign with almost no agency over their own bodies in terms of care. However, from the 1950s through the 70s, women's activism changed the discourse on breast cancer in the United States. Female-centric activism emerged in 1954 when cancer survivor Therese Lasser formed Reach to Recovery, a group dedicated to supporting women who had lived through mastectomies. As Lasser envisioned the program, only women who had been through breast cancer themselves could become members of Reach to Recovery. Volunteers would discuss effects of mastectomy with patients, tell them about various breast prosthesis options, and teach exercises that restored arm mobility after such a radical surgery. In 1953, before the organization's formal initiation, Lasser published Reach to Recovery, a manual for women who have had radical breast surgery. In this homemade publication, Lasser offered several tips, many of which no doubt had proven useful in her own rehabilitation. Much of her advice hearkened to traditional gender roles, like the advice to practice household exercises like vacuuming. Her program proved wildly successful, and the American Cancer Society adopted it under their philanthropic umbrella by 1969. Reach to Recovery relied on a network of women. Lasser focused on the idea of using the biological body as a central rallying point in a way heretofore unimagined. By using a network of women with shared experiences, Reach to Recovery adopted the technique of offering oneself as evidence. Though Lasser may have insisted that Reach to Recovery cooperate with doctors, her priorities centered on patients and their recovery, not medical practice. Most significant, this support network centered itself around the body. Only women who had undergone treatment, namely a mastectomy, could participate. This tactic offered patients an invaluable support network and changed the way many women felt about their disease and their bodies post-mastectomy. However, Lasser made no attempt to involve her group in the larger politics of cancer. In the late 1960s, when feminist health activists first turned their eye to cancer, they looked at the outdated treatment plans, largely unchanged since the 1890s. As late as the 1970s, when a woman would come for a biopsy of a suspicious lump, a surgeon would remove an affected breast without ever waking the patient from initial anesthesia required for a biopsy. Doctors argued that time was of the essence in breast cancer and that the risk of metastasis increased the longer a patient avoided a mastectomy. Thus, women who came to the surgeon always entered the operating room without knowing if they would wake up with both breasts or not. Activists took up arms against doctors to claim agency and ownership over their treatment. Rose Kushner, whose lasting impact on the field of breast cancer surgery reverberates to this day, initiated a new wave of feminist activism against a controlling patriarchal medical system. In 1974, Kushner noticed a lump in her breast. Determined to make her own decision regarding the surgical approach, Kushner argued with surgeon after surgeon who insisted she should have a radical mastectomy. Finally, the 20th surgeon she consulted with agreed to start only with the biopsy. After a positive biopsy and a later modified radical mastectomy, Kushner entered remission but remained angry at the system that sought to deny her agency over her own body. In her 1975 expose, Breast Cancer, an Investigative Report, Kushner emphasized that women should have the right to choose and the right to forego the one-step mastectomy. Her activism and teachings infuriated doctors who insisted their authority should be respected. Unlike members of Reach to Recovery who angered doctors because they approached breast cancer outside the authority of a doctor, Kushner angered surgeons because she worked against medical authority. By prioritizing women's autonomy over medical expertise, Kushner challenged the authority doctors held over women's bodies. Kushner's version of activism represents the advent of a social movement dedicated to changing the way women in the United States experience the most common of female cancers. Fighting the structure of medical profession proved much more daunting than fighting ignorance, which partially explains the enduring nature of the one-step process. The medical arena, as Irving Kenzola points out, is the battleground, not because there are visible threats and oppressors, but because they are almost invisible. Not because the perspective, tools, and practitioners of medicine and other helping professionals are evil, but because they are not. In this same vein, women receiving treatment for breast cancer constantly heard the message of for your own good. Patients could hardly argue that doctors saved their lives the wrong way. After all, when a patient survived, how could their methods be wrong? The novel wave of activism in the 1970s argued that survival was not enough. Some, like Kushner, advocated to rights for control over their own bodies. Other women worked to reframe the way that women in the wider public understood the disease itself. The rise of the women's health movement in the 1970s helped breast cancer patients reimagine their diagnosis. Many theorists, like Susan Sontag, entered the discourse after receiving a diagnosis of their own. Like other women of the 70s, Sontag refused to undergo a one-step procedure. Though her cancer was malignant, Sontag survived thanks to a combination of radical mastectomy and 2 years' worth of aggressive chemotherapy. Already a known cultural critic, Sontag took up the pen to write in condemnation of cancer culture in the United States. Her 1977 essay, Illness as Metaphor, Sontag rails against the casual linkage drawn between cancer and mysterious evil, like discussion of a Maoist cancer in China, or description of Stalinism as the cancer of Marxism. People use such comparisons to cancer, she argued, to signal that an event or situation is unqualifiedly and irredeemably wicked. However useful cancer as a metaphor might be, though, the people who have the disease are hardly helped by hearing their disease's name constantly being dropped as the epitome of evil. As a cultural critic, Sontag held less concern with the medical profession than with the overwhelming cultural norms that now influenced how a patient experienced cancer. She wanted to see change in the language of cancer as much as the treatment process. Other women worked to separate the association of breast cancer with traditional femininity. Audre Lorde, a professor of English at Jay College and a well-known African-American lesbian feminist poet, took on the topic of reconstructive surgery so many women elected to have after mastectomy. After her own operation in the 70s, Lorde elected to eschew the common secondary procedure. Lorde's criticisms of reconstructive surgery were many. As a lesbian, she had no interest in catering to the male gaze. As a black woman, the commonly produced white prosthesis clashed horribly with her skin. Despite how closely breasts intertwined with the fundamental definition of femininity, Lorde found a broad range of support, from doctors who feared interference with recovery to other activists who saw the mastectomy scar as a badge of honor. The decision of Lorde and other women like her who refused both augmentation and prosthesis presented a public, unmistakable use of the body to raise awareness. Even something as simple as walking down the street promoted visibility of the consequences of breast cancer. Besides acting as a spokesperson and representative for women with mastectomy scars, Lorde brought important attention to the experience of black women diagnosed with cancer. In reality, black women die at a much higher rate from breast cancer than white women do. A 1972 publication known as the Howard Report revealed that African American people die at a higher rate overall from cancer. This report, authored by researchers at Howard University in Washington, D.C., considered everything from biological traits to change behaviors to substandard care to explain why black cancer rates increased at such a high rate from the 50s to the 70s. Regardless of cause, the fact remained that the death rate was and still is higher in African American populations than in white ones, and yet their struggle stays invisible. Unlike white middle-class women, who had seen friends, family members, fictional characters, and celebrities face cancer since the 20s, black women had no such representation. The very first public figurehead for black women with cancer did not arrive until the 1970s in the form of Minnie Riperton, a famous singer and entertainer. Unlike Lorde, Riperton did not live long after her mastectomy. In the brief years before her death, though, she lectured throughout the United States, expanding the platform of cancer education to include black women. Lorde, who lived much longer than Riperton after her surgery, expanded on Riperton's example and offered black women a new way to relate to the disease. These labors of an embodied movement-style health activist against bad practice resulted in one goal realized: the fall of the radical mastectomy. As early as 1971, before the women's health movement began their crusade against cancer culture in earnest, the American Cancer Society had begun to question the value of the radical mastectomy. The 1971 policy report, Conservative or Radical, presented data on the radical and modified mastectomy, lumpectomy, and even radiation, conceding that favorable results with other methods than the Halsted-originated surgery existed. Even so, the ACS still recommended mastectomy as the most reliable cure. By the late 1970s, the conversation turned. By 1979, physicians dethroned the radical mastectomy. A combination of pressure from medical communities outside the United States and pressure from activists within the country coalesced to force change in the standards of practice. Over the course of 20 years, women's participation in the anti-cancer crusade changed dramatically. Lasser's efforts to humanize the experience of women with breast cancer opened the door for change in how American women approach the disease. The iron grip of the radical mastectomy haunted women for decades, but with the rise of the women's health movement of the 1970s, a new view came to the limelight. Cure by disfigurement was not enough. Women like Rose Kushner, Audre Lorde, and Susan Sontag challenged the medical and social ideation of breast cancer through the 1970s, pushing for more bodily autonomy. Their activism helped women to take charge of their own care, an important development as the relationship between doctors and female patients remained contentious, and does to this day.